Hey everyone, welcome back to the channel. So today what I'd like to talk about is I'd like to take you through a guide to helping you solve a disc bulge or herniated disc. Now it's a conversation that we have a lot where a disc bulge is, or the term disc bulge is thrown around a lot, and the diagnosis of a disc bulge is also very common. But there's a lot of the times there's more to it than we actually talk about, because one of the things that we miss with a disc bulge is the primary way that we diagnose a disc bulge, apart from obviously we know that someone has some lower back pain. We often use an MRI, a scan, we look at your spine, and then we can see that there's a little bit of a bulge in one of the discs or a couple of bulges in discs. And if we determine that that's protruded enough, potentially if it's irritating a nerve and you're getting some symptoms down your leg, for example, we often are quick to say that you have a disc bulge. You've bulged a disc and that's the source of your pain. What's equally challenging for a lot of people is when we get scan results that come back and you don't have a disc bulge, but you still have pain. And the scan doesn't necessarily give you an obvious cause or something or a foundation that you can hang your hat on to say, this is my problem, and give you some direction to say, well, this is where we need to go to solve that problem. And one of the things we see clinically is a big problem with the disc bulge diagnosis is it may not be accurate. Obviously, when you look at someone's scan, an MRI, you read the report or look at the images, you can see or read a disc bulge, and it becomes very, very easy to say, well, I have back pain and there's a disc bulge here, so those two things must be connected. So my issue is disc bulge related. Clinically, that's often not the case. The interesting thing about scans at disc bulges is if we were to line up 100 people that have never had a sore back before, and we MRI'd every single one of those people, the research shows that there's every chance that a large majority of those asymptomatic 100 people have a disc bulge in some degree, but they don't have pain. Now, what complicates this is that if someone who we happen to scan just as a test and they had a small disc bulge, if at some point down the track they started to develop some lower back pain, we would then scan their back again and say, well, look, there's a disc bulge there, so you have pain, but we didn't realize that potentially that disc bulge was there all the time. And what we need to do as clinicians and as patients is become more sophisticated at saying, well, I can see that there's a bulge in my back that maybe it doesn't look perfect, but is it symptomatic? Is it actually the source of my pain? And it's a really important question because a lot of people who try and treat their disc bulge are thinking that it's the cause of their pain, and obviously in some cases it can be. It can give you a bit of misdirection where you can put all your time and energy to doing a whole bunch of things to get that disc to settle down, when in actual fact it's not the cause of your pain. And just to, I guess, elaborate on that further, what we often find is that the structures that don't look damaged or injured on a scan, it can be coming from higher up. So that base of your rib cage, the joints, the tissues either side of your spine, if they get overloaded and irritated, they can refer pain from sort of the area that they become irritated down to that low back area. Basically, it can layer pain over the top of that disc bulge, give you the impression that you've got a disc bulge when in actual fact the pain's coming from higher up. And we did a video on that recently, and I'll link to it up here. But I just wanted to touch on that point because if you've been given the label of a disc bulge, just be careful, because it doesn't guarantee that the disc bulge is causing your pain. You need to match that up with a skilled therapist who assesses you, looks at all your signs and symptoms, can treat you, and then reassess how you feel. And generally that's the main way, the best way to figure out whether you actually have a disc bulge. But obviously, at the end of the day, it probably doesn't even matter. Obviously there are some specific things you can do if you have a disc bulge that we've learned that help or may help you, and we'll go through one or two of those in a second. But if you take a step back and divorce yourself from the label for a second and say, well, look, whether I have a scan that says disc bulge, even stenosis or nerve root impingement, whatever it is, if you take a step back and divorce yourself from the label and create a new label for yourself that just says my lower back is dysfunctional, then you can start to take steps to improve the general function of your back, how you load it up, how you use it, and in turn that'll hopefully help normalize a lot of the tissue regardless of which tissue it is that's struggling. But for the purposes of this video, I wanted to make something. I wanted to make it clear that a disc bulge is a highly misdiagnosed issue, in a positive way, because there's more things you can do when you sort of remove yourself from that umbrella or that bucket of being labelled with a disc bulge. So if you're someone who's watching this video and you've been struggling with a disc bulge for a long time, do some of these broader ideas, and then hopefully you'll find that they'll start to settle down your pain and make it feel better without needing that disc bulge to sort of resolve and come back in again. Because again, we know that you don't have to have a perfectly looking spine on a scan to feel fantastic, nor do you have to have an issue on a scan to have horrible pain. The key that binds all of this together is how you use your back and how you load your back up. Those things generally the source of all pain, or all low back pain. And there can be some more sinister cases where the structure of the tissue, if a disc has herniated quite significantly, if you've worn your joint down to a nub, irritating a specific nerve root, there can be some symptoms that need specific help. But for the most part, there's some broader things that you can work on. So I just wanted to make that clear. So there's a lot of hope for people with that diagnosis, because there's more that you can do than just that you're led to believe with the disc bulge diagnosis. So that being said, there's sort of 4 or 5 things that I'd like to touch on that I would like you to try and attempt and try and do. The first one's a very simple one. Again, we've done a video on this before, and I'll link it up here, but the idea we want to get you to try is to just grab a tennis ball or a lacrosse ball in this instance, and we want you to go hunting for stiffness and tightness in your back. Again, if your pain is right down the base of your spine, maybe don't go pushing around there just yet. Start above and work your way down. Now, for a lot of people, if your symptoms are pain or a band of pain across your lower back, obviously at the back, pain into your hips, even if you're getting some pain down the back of your legs, give this a go just in case your pain's referred from somewhere else. So what I'd like you to try is with the ball, and obviously we're going to put this around the back, but you've got your spinous processes down the middle. You can feel the bumps at the back when you run your fingers up and down. What we want to do here is, starting at the base of your rib cage, have the ball in the middle, and then just let it roll off to the side, immediately off to the side onto the shelf. And how that looks is, we're going to start higher up here, just let the ball roll off to the fleshy part on one side, and we want to get you to lie down on top of that. We're just going to get you to stay here. So we want you to hunt around, go looking for spots in your back that feel stiff, tight, potentially tender. But more importantly, we're looking for something that gives you, sort of reproduces your symptoms. So if you are avoiding the lower section, but you're coming up a little bit higher, and you are on one side and you hit a spot that feels stiff and tight and tender, and all of a sudden you feel that same discomfort that you've been dealing with, whether that discomfort increases or decreases, it tells you that the part of your back that you were just pushing on is connected to that. Now, the second step to this is, if this area feels really stiff on my left-hand side here, and you move the ball across to the other side and it feels more stiff and more tight, you actually want to spend more time on this side. Even if this is the side that's giving you your symptoms, the level itself is restricted. There's a handbrake on there that's stiff. So if it's stiffer on the other side, you actually want to spend a lot of time on there to take that handbrake off and allow the other side to function better. So it's a really important distinction. And once you spend some time on one particular level, just systematically work your way down as low as you feel comfortable going. You can't impact the disc, you can't touch the disc with the ball. It's deep to a lot of bony structures, but you can influence the joints around that. So if you have a disc, if you do have a disc right in the base of your spine that's irritated, you want to feed as much slack into that disc as you can, and getting the ball into the tissue above and below and around that can be quite useful. So spend some time doing that. It can be really useful to addressing your signs and symptoms. Now, the second exercise is more of a stereotypical disc bulge exercise, and it's an extension exercise. And the reason why we do this is, when you think of the spine, if we've got a spine and here's one level, here's another level, you've got the disc in the middle. If we're often bending forwards, leaning forwards, what we're essentially doing is compressing the front of the disc and creating this extra tensile stress pushing at the back, which is the reason why the disc itself often bulges backwards. We don't see too many discs bulging at the front, it's always at the back. More often than not, because we're in this sort of flexed posture, whether we're leaning over or whether we're just stuck in a crappy spinal shape for hours on end, we're constantly asking the disc to bulge backwards. So the theory is that we want to try and go the other way. Instead of allowing the disc to push out the back, we're trying to sort of capture that disc and pull it back into the middle, essentially. And how that looks is very, very simple. And again, if you're in a lot of pain, please take your time doing this, but ideally we want you to be on your stomach, depending on how you feel. The exercise itself is keeping your legs and your hips on the ground and just gently extending your back up as far as you feel comfortable. Now, if your pain comes on relatively quickly and you can't keep maneuvering up and down to this position, there's nothing stopping you staying in this position or a version of this position for a couple of seconds, 20 seconds, 30 seconds, breathing through this, allowing that disc to centralize and settle down. If it's too high, you can certainly lie down or have a pillow underneath your arms just to hold you in some form of extension. But ideally, we want you to be trying to arch backwards and free that up. And what you might find is, if this is an exercise that's going to help you, and you have that radiating pain into your legs, there's a term called centralization where the sensations you're getting will start to sort of centralize or move back towards your spine, and it may actually make your spine feel sorer at the expense of the pain and the symptoms in your leg. That, say if you've got some pain and some numbness or some tingling or a burning feeling or something in your legs, that centralization feeling means that sensation or those sensations will slowly make their way up into your back, settling it down here, but your back might start to get sore, and then eventually that pain may go away once that disc is settled down. That's a good sign. It's a sign that things are working, but it obviously work within your limits. So that's important exercise too. And the interesting thing about that is, in order to extend backwards, you need the joints in your back to be able to move. So when we used the ball before, pairing those two exercises together can be really useful, because if those joints are de-stiffened with the ball, it gives you more capacity to extend through your back safely without jamming something up or pinching something up because those joints are rusty. So that's exercise number 2, the extension exercise. Couple that with the ball exercise. The third exercise is a little bit left of center, but it's a way to help you manage your pain. And again, we've spoken about this before, and we'll leave a link here as well. But pain is more than just damaged and injured tissue. It's your brain and nervous system's perception of threat. So it often explains why you can have a very small injury but have quite a large amount of pain, because it's not related to the amount of damage, it's more related to how threatened your nervous system is in the presence of that. So as we've discussed before, if you have other things going on in your life that you're stressed about, or had some horrible things happen in your past, trauma-wise, whether it be abuse or anything like that, or you're dealing with a lot of stress at the moment, which is quite easy in today's climate, those extra stresses are lumped on top of an already heightened, threatened nervous system, which can serve to increase your back pain and keep it there. So not only do you need to work on the physical aspect of freeing things up and settling down the disc, but we also need to work on an exercise to get your nervous system to relax and release and to feel less stressed and less threatened, and then your pain should follow suit. So a very simple thing to do for that is something called box breathing. It's just simply a pattern of breathing where, say for 5 or 6 seconds, you take a breath in. So it basically looks as follows. Breathe in for a few seconds, you pause at the top for the same amount of time, and you breathe out for the same amount of time, and you pause at the bottom again for the same amount of time. So a good starting point is 5 seconds. So 5-second breath in, 5-second pause at the top, 5-second breath out, 5-second pause at the bottom. And keep doing that and doing that and doing that for 5 goes, 10 cycles, until you feel your nervous system drop down a gear or 2. It's really important, because as that nervous system becomes less threatened and less challenged, your pain perception will decrease as well. Your pain experience will decrease, and you'll be able to do more with your back. You won't feel as irritated and sore and sensitized once that nervous system comes down again. So those things together are really powerful in terms of trying to get that disc to settle. The fourth thing is sometimes with a disc bulge, because they tend to sort of bulge out the back, that's also where our nervous system and our spinal cord resides. So often we see with some form of disc bulge, if it gets irritated and inflamed, the nerve itself can get annoyed, and you can get that tingling, the numbness, the burning, down the leg. And a really simple way to try and sort of get that to move better, apart from de-stiffening your back, trying to get the disc to settle and getting your nervous system to settle, is we can give you a mechanical nerve root flossing exercise. So the sciatic nerve that goes down the back of the leg starts from your lower back and runs down the course of your leg. A really simple way to help that is if you're lying on your back and you have one leg out straight, the other one we want to have at about 90 degrees, but keeping your foot bent back. All we want you to do is just gently straighten that leg as high as you feel comfortable for 10 to 15 repetitions. And we want you to stop short of irritating it. So if you get to a point where it catches and it pulls, just gently work within that range. But the idea here is, if you watch me do this, is so for me I can get to here at the moment. If you just look how high I get, what should happen is the more I do this, the more I shear this free and floss this tissue, you should hopefully see that my leg starts to go straighter and straighter and straighter without necessarily bending that hip. So keeping things relatively still, the leg starts to extend further. And what we're doing here is we're shearing free that nerve as it runs through all the soft tissue as it originates from your spine and goes down through your legs. So trying to free up that nerve and unglue that nerve, again, can help settle down those symptoms if everything's jammed up back there. So those 4 exercises, I think, are really, really important exercises to help you try and get your symptoms under control. Depending on the various pain levels that you have, you may need to spend more time deep breathing or box breathing to get that pain under control. Obviously, there's things like medications, heat packs, avoid ice, it's no good generally. Some things that you can do to get those symptoms to settle a little bit so that you can work on your mechanical issues underneath and your nervous system issues, so that you don't need to keep using medications and things like that. So those 4 exercises I find very useful clinically. The 5th part of the puzzle, and we touched on it briefly at the start, is possibly one of the most important things. Now, if you have a disc bulge or a disc issue, sitting in general is not going to be your favorite thing at the moment, because gravity, standing and sitting in general, the weight of gravity is compressing that spine. If you're also sitting and slouching, that increases the amount of tension going through the disc, tenfold potentially. So that may not like it, but one of the things you need to be aware of, either when you can start to sit again, or once you feel good and your problem's solved or resolved, you have to value the position that you put your back into. So as we talked about briefly, with that disc bulging because of a flexed position, if you spend any time throughout the day in a position that's less than ideal, less than neutral, and getting sucked into these shapes, you're always going to be asking that disc to want to bulge out the back. It may not necessarily bulge in a dramatic sense, but the tissue in there can get irritated if you're always in a bad hinged or flexed position. So you have to prioritize better shapes. Otherwise, you can't promise that you won't have back issues in the future. Like anyone, it's very hard to develop a spinal problem if you can practice good postures. If you don't care, or you don't care enough, you just leave the door open for something to happen. It may not, but if it does happen, hindsight's perfectly clear. The positions and the shapes that you're in, how you bend, how you sit matters. So you have to take care of those things. So hopefully those 5 ideas, plus the discussion about what it looks like on a scan and how that relates to a disc bulge and your pain, hopefully that gives you a quick, simple guide to start to chip away at your dysfunction. If you have liked the video, please leave a like below, and if you would consider subscribing, it really helps these videos sort of come across more eyes. If you know someone, or if you're part of a group that have that sort of looks after people with disc bulges and back pain, please share this video in the hope that it'll help them as well. But we're putting out content as often as possible, hopefully addressing issues that people have. Hopefully it's useful information and real information that works, because it's stuff that we do clinically. So if you have any questions, please leave a comment below. But until next time, I'll see you soon. Bye.